Afternoon, everyone. Does that sound good? Is that too loud? Thanks so much. I hope everyone enjoyed their lunch. We're going to go ahead and get started, even though I know folks are still trickling in from lunch. Hello, welcome. My name is Stephanie Salgado. I'm a project coordinator with the Healthy Chicago Equity Zones here at CDPH. And I'll be your room moderator for today. For those of you who are just joining us, maybe you missed the first session, I just want to welcome you to the Healthy Chicago 2025 Symposium and the HCEZ Showcase, where we're bringing partners together to recommit to the Healthy Chicago 2025 plan to close the racial life expectancy gap and build the relationships we need to make that happen. This is Breakout Room 3, Implementing Healthy Chicago 2025, Priority Areas via Health Equity and All Policies. So this session will be led by the Health Equity and All Policies team, or the HEiAP team as we call them. The HEiAP team is a team at CDPH focused on centering equity in decision making and building and shifting power through community government partnerships. So they're going to give you a presentation today to introduce you all to the HEiAP approach, and then they're going to lead you through an interactive session to reflect on the ways that we can all grow with partnerships. So I'm going to pass it to Cindy Edmond, who is going to go ahead and introduce herself and her team.
Hello everyone, I am Sid. I use she, her pronouns, and I am part of the Health Equity and Policies team at CDPH.
Hello everybody, I'm Clay Dove, and I'm a senior policy analyst with the Health Equity and All Policies team.
Good afternoon, everyone. My name is Susan Martinez. I'm a coordinating planner on the Health Equity and All Policies team.
Good afternoon, everybody. My name is Eduardo. He is pronouns. Happy that you're here, and I'm also a coordinating planner with the HEiAP team.
Amazing. We are a small but mighty team, so I'm going to get back over here so that I can advance the slides. Thank you, Steph. Hi, everyone. Thanks so much for joining us today. I have a soft voice, so if you can hear me, clap one time. Just wanted to make sure. I know for me personally, I've had a busy week. I'm sure many of you have had a busy week. So if you can just come with me, take a deep breath. Allow yourself to just acknowledge where you're coming from today. Take a few more deep breaths and allow yourself to then be in space with us. So again, I'm Sid. I use she, her pronouns, and you have now met the Health Equity and All Policies team. We are a team that believes that equity is attainable in Chicago. And so what we focus on is centering equity and decision making across Chicago. And we also focus on building and sharing power through community and government partnerships. So as we mentioned, today we're going to kind of tell our story about who we are, the work that we do, and how we do that work. And then for most of the hour, we're actually going to give you some time to think about the work that you do and what brings you here and how we can all grow through partnerships. And as Steph mentioned, we refer to ourselves as HEiAP. It is our acronym, HEiAP, so you will see that throughout the slides and hear it very often today. So, what is health equity in all policies? You may have heard about the health and all policies approach. It's actually becoming a very common practice around the country. We are focused on health equity, health and racial equity throughout the process. And I know there's, again, a lot on this slide, but what we're trying to tell you is that our work did not start when our CDPH HEiAP team was established last year, thanks to our founder, Taylor Cannon. Healthy Chicago has actually been on a journey of movement over the last decade. And actually in 2016, City Council actually adopted a health and all policies resolution. Who knew, right? And then there was a task force that recommendations for policy change in the city to reduce health inequities. And then when our city declared racism as a public health crisis, HEiAP was actually listed as a strategy for operationalizing health equity in the city. And then last year in 2022, the HEiAP team was established. So now I will pass it to my colleague Susan, who will talk more about our relation to the Healthy Chicago movement.
Hello. Okay, great. So, hello, I'm Susan, she, her pronouns. So I'd like to take some time to explain a little bit about our team and how it connects back to the Healthy Chicago 2025 plan. So, as you see, just kind of to recap a little bit about what was shared this morning, Healthy Chicago 2025 is the citywide health plan to close our life expectancy gap. So there's a couple ways that we do this, and so I'd like to make point folks' attention to the little circle diagram we've got going on here. So how do we do that? It's really through identifying local priorities, taking action, and evaluating progress. And one of the things that we heard in some of the stories shared this morning was how much of that is done through community co-leadership. And so that is something that we truly believe in, not doing this by ourselves and working in partnership. And that's how we would really try to get to the roots of social determinants. So these social and institutional inequities that we see in our work. Next slide. How is our approach different? So Healthy Chicago recognizes that how we do our work matters as much as what we do. So we have these 6 guiding principles to help create accountability and explain how institutions can better serve all Chicagoans, right? And then I think the next slide shows a little bit more about what does it look like for health equity in all policies to be in action. So when we talk about health in all policies, it's really to make sure that government works with communities. And so what does that look like? Mobilizing partners and collaborators, and how do we advance health equity in particular? So the next slide talks a little bit more about what that looks like in some of the Healthy Chicago 2025 areas. So as part of the HEiAP team at CDPH, our team supports advancing policies, practices, and decisions across city government that eliminate health and racial inequities and benefit the health of all Chicagoans. So we support advancing these priorities through the following focus areas: housing, food access, environmental justice, neighborhood planning and development, and institutional change. So if you look at your tables, you'll notice we wanted to organize you all in the focus areas that you all work in, but also understand that there are some interconnections between all of yours. And so we're hoping to have a conversation with you all about, how do we do this together? A little bit about our strategy in particular. So as Sid mentioned earlier in the presentation, we see structural a lot in health equity in all policies. So for us, what does that look like? It looks like capacity building. So normalizing health equity framing across sectors and policy areas to build capacity to center health equity. Organizing and mobilizing. So organizing transformative community and government partnerships to build, share, and shift power. And then finally, the systems change, policy and system change. So how do we operationalize health equity in decision-making to advance policy and systems change? And we see these as interchangeable, so all of these happening together, because we know that not everything is coming together to help form more structural change together, rather than government doing this by itself. So I'm going to hand it over to my colleague Clayton to share a little bit about HEiAP in action.
Thank you, Susan. So I will just go through some of the big projects that we've done as HEiAP that kind of highlights each of the focus areas of Healthy Chicago that was just mentioned. So starting here, this is our equity decision support tool that I think was mentioned in the presentation earlier. And this is still yet to come, not officially out there yet, but it will be a tool by which governments, elected officials, and community organizations can go through decisions, ask questions, figure out what's the best way to optimize equity with this. And this is an example of our institutional change work that we're doing with HEiAP. Next slide. A big project that we've spent a lot of our time on this past year is the Cumulative Impact Assessment, which is our project that we are doing co-led and co-designed with community partners in the environmental justice space. And this is a process by which we'll assess the full cumulative impacts in decision making and build policy out of that for future change. So next slide. And so those are two that are still coming, but some that we have already done. To the left, you can see our health and racial equity impact assessments on that was the equitable transit-oriented developments. And that was a report that our team did that helped define the connected communities ordinance that went into effect earlier this year, I forget. We helped support the Food Equity Council, and that is represented by the Food Equity Agenda here. And then we also helped support the Systems Change Collaborative to help improve our systems for those experiencing homelessness, and that is an example of our housing work. So next slide. All that's to change the system, we need more than just those tools. This is a reminder that our work with health equity and all policies is both as we say, a head and heart work. So we really want to highlight, if we are going to make any progress, we need to start with the body. So that's just to highlight the importance of that. And I'll hand it off to my colleague Eduardo, and we'll get started on our activity.
Thanks, Clayton. So what do you guys think of all the work that we've done so far? Yeah, definitely. So we're going to go ahead and get started in a semi-short activity. What we're going to do is, and the purpose of this activity is to actually identify assets and discuss how we're going to continue building partnerships. We're going to also uplift all of the work that has been happening with our communities and our organizations and our co-partners. And then we're going to also highlight priorities for the next Healthy Chicago plan. So with that said, what we're going to do is, before we start the activity, we kind of need to know each other, right? So we're going to do some small introductions with the table that you're in. So between 2 to 3 people per table. And what we're going to do is we're going to introduce ourselves with our names. You're going to say your pronouns, organization, maybe key projects that you're working on. And then maybe one of the first questions that you can ask each other is, how, on a scale of sheep, how are you feeling today? So I can start with myself, and on a scale of sheep, I'm feeling like a 5. So, yes. So we're going to give each other about 3 to 5 minutes with the person that you're in with your table. Definitely introduce yourself, and then we'll begin with the activities. As Susan mentioned earlier, in the table that you're in, that is the focus area that we're going to be talking about within your specific table, and then there's a couple questions that we'll go through that in just a second as well. So let's go ahead and introduce each other. On the table, we have some big post-its, right? We have the housing section, we have the neighborhood planning and development, we have the environmental justice, and then we have food access on the side. So based on your table that you're in, right, you have 3 questions, okay? And we're gonna spend about 10 minutes per question. So the question number 1 that we're going to be doing is, What are community strengths and assets around the selected priority area? What are the big wins across this priority area over the last 3 years? So what we're going to do is you have some sticky notes and you also have some pens. So what we'd like to ask you is to write down your answers, right? And what you think is happening with this based on this question. And you're going to go ahead and post that sticky note to the question that's on the post-it. Okay? So we'll go ahead and again, we'll start about just now and we'll give about 10 minutes, but then we'll also be going around the room to, if you guys have any questions or maybe, collaborate on more answers. And then we'll also let you know when it's going to be the next phase to the next question. Does that sound okay? Sure. We're all good? All right, great. So let's go ahead and get started.